So I'm Lisa Playford. I'm the engagement lead at 1U East Sussex, and I'm here with Hattie Deacon, who's our NHS Health Checks lead. And you're at the 1U East Sussex webinar about NHS Health Checks. So hopefully you're all in the right place. As I mentioned, we are recording today, just so we can share it for the people that haven't been able to attend. And we're probably going to be using the reactions button and the chat box as well, just to try and make the session a little bit more interactive for you. Although, to be honest, we're such a small group today that if you just want to unmute and if you've got any questions as we go through, or you want to comment on anything, then please feel free to. So a couple of questions just to start us off. And you can do a thumbs up or a thumbs down, or just call out if you want. So have you heard of 1U East Sussex before? Yeah, everybody has. Brilliant. Have you referred into our service before?
No, don't think so.
No.
I've advised colleagues to, because I don't work directly with clients, but I've certainly passed your services on to colleagues within the team.
Well, that's good. That's great. You've all heard of us, and that's great that you've been promoting referral to us. So that's great. Thank you. So hopefully you'll still find today useful, even though you've already heard of us, because Hattie will be taking you on a sort of a bit of a deep dive into the NHS Health Check service, what that looks like. And so hopefully you'll find it useful for them when you're pointing people in our direction. You'll know what it is you're signposting them to. So this is the running order of today. So I'll give you a brief overview of what it is that we do at 1U East Sussex, and then I'll pass you to Hattie for the main event, and she'll sort of talk about the aims and outcomes around health checks, what the service actually entails, and then there's an opportunity at the end for you to ask any questions you have. Although given we are such a small group, if anything does come up as we go through, do feel free to just shout out, it's fine. Then Hattie will pass back to me, and I will give you some key contacts and let you know how you can refer into the service. I will share the slides with you as well after this session. So there's a few emails and phone numbers coming up later on, but you will have those by email anyway. So don't feel you have to madly scribble notes. So what is it that we do at 1U East Sussex? So put really simply, we help people to make small changes that can lead to quite a big difference over time in terms of their health and well-being. So it's quite an holistic approach in the service, cover a whole range of things, and we can help people with that menu of things you can see down the right-hand side there. So we help people to give up smoking, to eat well, to move more, to drink less, and to lose weight. We have over 70 clinics located across East Sussex, and we're a free service. We're commissioned by Sussex County Council, so there's no means testing. Some of the pathways do have some eligibility criteria, and health checks is one of those, and Hattie will talk to you about that in a little while. But it is free at point of service, basically. And people can self-refer, or you can refer people in as a professional supporting that person. And the aims of the service are to reduce the prevalence of lifestyle risk factors, so such as smoking and obesity in the county, to hopefully reduce the morbidity and mortality associated with lifestyle factors. And I guess the ultimate aim really is to reduce the pressure on the health service and social care. So that's sort of the overarching big picture. I mean, I know from our point of view and all the people that work at 1U, obviously our aim is to help people live a happier and longer life, better quality of life. So I'm just going to tell you a little bit about each of the services then. So when we receive a referral in, for all services except for NHS Health Checks, people are offered a health assessment, an initial health assessment, which covers sort of basic things around their health, height, weight, what it is they're looking to achieve, why they've accessed our service, and sort of identify the goals that they have, very client-led goals. And then they're triaged onto sort of the most appropriate pathway, we call it. So for our healthy lifestyle coaching, that's mainly the drink less, move more, eat well pathways, although it can also offer one-to-one weight loss as well as part of that pathway. It's a program of 12 weeks of one-to-one support with a health coach, and it's really quite successful. It's a lot of people reach their goals that they set. They sort of set one primary goal around those pathways, and then they might choose another one as well. But it's yeah, really successful. Another one of the major offers is stop smoking support. So again, somebody's allocated a stop smoking advisor, and they meet with their stop smoking advisor initially weekly for the first 6 weeks, and then fortnightly for another 3 weeks, another 3 meetings. So 12-week period in total. And it's like a two-pronged attack on smoking. So it's behavior change support, so in terms of breaking the habit, and it's also nicotine replacement therapy on a reducing dose over the 12 weeks. And that could look like patches. Usually everybody's offered patches to reduce their baseline levels of cravings, and then another oral form of nicotine replacement therapy as well, which could be gum, it could be an e-cigarette, it could be lozenges. We've also recently teamed up with, I think it's South Downs Health and Care, to offer people varenicline, which is the stop smoking medication as well. The other thing in terms of smoking, is we've just launched a pilot study as well for vaping cessation. So that's a year-long pilot study aimed at adults just over 18, people over 18, and we were getting increasing demand, people asking us, can you support us to stop vaping? And at the time it was a no, so we've our commissioners have kindly agreed that we can do this year-long pilot study to see whether or not, because that seems to be the direction that we're going in, doesn't it, in terms of public health, with the vaping risks. The other big service that we offer is adult weight management. And obviously I've mentioned people can access one-to-one support for this through the health coaching service, but we also have small group sort of peer support settings as well, led by a health coach, a program over 12 weeks. And it's not a diet, but it's a way to help people transition to a sort of sustainable, healthy lifestyle that can help them achieve a healthy weight. And it covers a whole range of topics related to being a healthy weight, from obviously exercise and the role of sleep, hormones, supermarket marketing, how they get us to buy more and naughty things, more than we need. Yeah, a whole range, is quite an holistic approach to it, and again, really successful, and really a lot of people achieve 5% weight loss who join that program. We also have an online platform called Glogy Digital. So for people that perhaps like to be a bit more self-led or can't make a group, they can access this online, and it's a series of different videos and lots of information and articles, but they can also have a weekly call with a mentor as part of that, a telephone call. And we also have a branch of weight loss aimed specifically at men. Men traditionally don't join these weight loss groups as readily as ladies. And so this branch is aimed specifically at them, and it's called Man v Fat. And it's actually 6-a-side football, and the matches are decided on weight loss as well as goals. And that's proved really successful. Seems to tap into that competitive nature that a lot of men have, well, and women, but it's yeah, really fun, that one. Just to add that some of our weight loss groups are based in leisure centres, and where they are, we can offer free swim and gym passes for the duration of the programme at a lot of those, specifically with Freedom Leisure we've worked with in Hastings and Helsham. And we've also got a discounted rate available for clients that are based in Eastbourne as well, the Sovereign Centre with Better. So that's really useful. So that's most of the key services that we offer for people. We also do provide training to our community, voluntary and health sector partners. So we can provide training on health checks and use of the Cobus machines that are used for health checks, and we can also provide training for stop smoking advisors. The main training offer we provide is the Making Every Contact Count training, which is about how all of us people that are having these hundreds of conversations with clients in our day-to-day jobs, health comes up a lot, and it's how we can really make those conversations around health really effective and help direct people and signpost people to support services that can improve their health. So that's really quite a popular offer, the Making Every Contact Count training. And we've got a training page on our website. You'll see the website address there. So if you're interested in any of those free training, you can just get in touch and book it. We run sort of open sessions throughout the year, but we also can bespoke them and come in and deliver at team meetings and training days and things like that. The other thing we're involved with is the Active Eastbourne and Lewis partnership, and very recently the Active Wilden partnership. And these are partnerships for leisure providers in these areas and activity providers. And they form a nice network so people can get together and share best practice and work together on particular projects. But they also are a really good online directory for people living in the community if they want to know where to go to find a particular activity. So if you were looking for armchair exercises in Eastbourne, for example, you could go on and do a search, and it would come up with activities. So the idea of that is obviously it's networking, it's access to information around health, around physical activity, and it's also building those partnerships. There's also a small grants fund as well with those partnerships, so grassroots can apply to us for funding that perhaps bridge any gaps towards accessibility of activity and leisure there. So that's the whistle-stop tour of 1U East Sussex, and I'm now going to pass you to Hattie for the main event, which is the NHS Health Check service.
Lovely, thanks Lisa. Like Lisa said, I'm Hattie, I'm the health check lead at 1U East Sussex, so I lead the team of NHS Health Check practitioners. So I'm going to explain a bit about the health checks, what we offer, how we kind of do them, and how you can have them at your workplace, or how you can sort of sign up if you're interested. So yeah, we're the locally commissioned service delivering the NHS Health Check programme. We deliver these health checks out in the community. We're in-house at some GP practices as well, and also various workplaces across the county, kind of anywhere and everywhere that kind of want health checks for their staff. The health checks are a health promotion and screening initiative, and they're delivered by our team of practitioners. Just important to note that we aren't clinicians. The health check practitioners are solely trained on the health checks. So for anything kind of outside of that, you do have to sort of recommend speaking with your GP if there's any other sort of issues you want to discuss. So the NHS health checks, they are only available to a sort of criteria of people. So this is set by the NHS, not us at 1U, so we have to follow this criteria. So it's for people aged 40 to 74. To access our service, you will need to live in East Sussex, which doesn't include Brighton and Hove because that's a different county council. Can't have previously had a heart attack, stroke, or TIA, so a mini strokes. It's about finding people it's about preventing these things from happening. So the people that have already had those things, they're probably going to be on medication or they're being monitored by their doctor. So it's about finding people that aren't aware of these things. You can't be diagnosed with diabetes, kidney disease, or atrial fibrillation. Can't be taking any medication to manage high blood pressure, high cholesterol, diabetes, or kidney disease, again, because it's about finding people that aren't already sort of being monitored for it. And they are every 5 years, the NHS health check. So you only qualify sort of every 5 years. Next slide, please. So just a bit about the health check, the NHS health check programme. So it was introduced back in 2009 to promote prevention, improve health, and reduce disease risk. It was part of it is part of a larger scale action plan that focuses on the 7 main preventable risk factors. So that's smoking, high blood pressure, obesity, inactivity, alcohol, poor diet, and high cholesterol. And it's estimated in its first 5 years, the programme helped prevent about 2,500 strokes and heart attacks through the follow-up treatment from the health checks. So it sort of highlights how effective the programme is and how important it is for that prevention side of things. So quick fire questions. So how many NHS Health Checks do you think we delivered since we started offering them? There's a typo there, but offering them in the service in 2017. Any ideas? Feel free to put it in the chat or shout out. If you're not sure, don't feel like you have to.
Let's throw a number out there, shall I? I don't know. Let's say, well, that is nearly 10 years, so a lot. 150,000. I'll throw that out there. No idea.
I like that. Yeah, that's good thinking. Not quite that many, but 14,000.
No, sorry.
That's all right.
Yeah, I thought that was quite a lot. It feels a bit underwhelming there.
Yeah, but yeah, we've done about 14,000 since 2017. So I'm just going to talk to you a bit about where we deliver these in the county. Firstly, though, just a bit about what the health check includes. So it's about 30 to 40-minute health check. We like to think of it as a kind of heart health MOT. So it's all focused on the heart and the cardiovascular system. So it includes things like height, weight, which calculates the person's BMI, blood pressure, and also a pulse rhythm check as well. A cholesterol test that's all done in the appointment, so it's a point of care test. We have machines that do this for us, so via a finger prick, and potentially a HbA1c test, which is like a diabetes screening. So that's for those people that qualify if they've got high blood pressure or a raised BMI. We then ask the patient about things like physical activity, their alcohol intake, and their smoking status. There is a bit of dementia awareness as well at the end of the health check, just sort of talking about how heart health is quite heavily linked to dementia risk. And then everybody gets what's called a Q risk 3 score. So this is essentially your estimated chance of developing heart disease or cardiovascular disease over the next 10 years, which we want to be below a certain figure. And if it's not, if it is raised, there's some things you can do to kind of bring that figure down. So it's all, again, all about that prevention. You also get heart age as well at the end, which a lot of people like, particularly if it's younger. You know, that feels good. It shows that they're looking after their heart health and they should carry on kind of doing what they're doing. But if it's older, obviously that's quite a good spur on to kind of make some changes to reduce that heart age, because it isn't set in stone forever. You can absolutely kind of improve it. And then we incorporate some diet and lifestyle advice as well at the end, and just talking about how you can reduce your risk. We can also refer into 1UE Sussex as well if the person is a smoker and they want to quit or they want to lose weight. We can kind of refer them back in with us. And then the results are then transferred to the patient's GP practice following the check, so they know that they've had it, and all of their results will get put into their patient file. So we deliver the health checks in various places in the county. So we have our community and workplace NHS Health Checks. So these are predominantly aimed at people that are kind of less likely to attend their GP. So it's about complementing the practice-based delivery. So specifically, we try and target people living in deprived areas, people with unhealthy lifestyle behaviours, and men who are typically less likely to seek health checks. However, it's not, you know, limited to these people. It is open to everyone, but that's kind of our focus. That's always has been kind of since the beginning. We deliver them, across sort of all different locations in the community, rural and urban areas. I'm going to talk a bit about our outreach van that helps us reach kind of more those more rural areas. So yeah, kind of out and about in lots of different places, which is quite nice. So this is our van. This is what we call Colin. So he stands for Community Outreach Lifestyle Intervention Now. So he's our trusted kind of converted camper van that we use for various events and things around the county. And we use him to deliver the health checks as well. So we've recently delivered 2 successful projects that we're doing again this year. We kind of do it yearly. So we partnered with Wealdon District Council to run our spring and autumn Wealdon tours. So with this, we visit 4 towns in Wealdon, and then the health checks are promoted by Wealdon District Council via various channels, so newsletters and press releases. And this has always been really popular. It always books up really, really quickly. And people like how we come to them. They don't have to kind of travel far or seek out clinics in different locations. We've done this the past couple of years and we're starting it again next week. So we've partnered with the South East Communities Rail Partnership and also Rother District Council to run our Rother Railway Roadshow. It's a mouthful. So we visit 3, I think more this year, 3 or 4 different stations in the Rother district, particularly in the evening, just to kind of catch those commuters after work. And again, that's been very popular and that tends to book up quite quickly. As well as our community and workplace and our outreach van health checks, we also have a collaboration with some GP practices in the county. So this first started in around 2019, 2020, where the station practice collaborated with us for us to come in and deliver health checks for their patients in their practice. So these are targeted checks, again, that are focused on priority groups mentioned previously, so the people that are sort of unable to or unlikely to take up the GP offer, but in addition, again, to everyone as well. It's not just limited to those. So how it works is one of our practitioners will go to the GP practice sort of once per week. We have a room, and then the GP practice is responsible for inviting out their eligible patients, sending out text messages. Then they come to us to book in, and then we go in and deliver the health checks. So it kind of helps us out because we deliver the health checks, and it also helps out the practice as well because it helps to sort of increase their health check delivery and sort of update their patient systems as well. So if someone is no longer a smoker, that will get updated via a health check and things like that. And then, yeah, following the completion of the appointment, we have a health check software that submits the automated read code results. So the sort of practice doesn't have to do much admin work to put that into the patient file. It's sort of quite automatic, which is good. So this has been pretty successful. We've got 7 ongoing over the years, and yeah, seems to be going strong still. So yeah, we definitely are very grateful for our GP collaborations. So just looking at GP referrals. So after a health check, if we pick up something like a high blood pressure or a high cholesterol, something that needs to be followed up by the GP, because like I say, we aren't clinicians, so we do have to refer on if we pick these things up. How many of the 2,238 health checks delivered in 24-25 were referred to their GP?
I think quite high. I'm going to go 1,500.
Yeah. Guess. So not far off. So 708. So about 36%, with the most common reason being high blood pressure. And then the second common being the Q risk result. So if that's a raised figure above the 10%, they do have to go see their GP. So just kind of highlights, yeah, sort of the importance of the health check and these things that we're picking up. And then hopefully those people who with the high blood pressure that then go to see their GP, they end up on the right treatment pathway from there. These are just some facts about the NHS Health Checks that I think from the same year. So you can see there that females, it's more heavily skewed towards females. So with 63% being female and 37% being male. But that is always something we're working on to try and reach more men, whether that's male dominated workplaces or men's groups in the community. It's always sort of an ongoing thing. The highest sort of area of delivery is Hastings and Rother, so that's our kind of priority area because it's sort of the most deprived area in East Sussex, closely followed by the other 2, so Lewes and Eastbourne, Helsham and Seaford. So it's just some interesting stats there. You can also see the ages as well. So most common being ages 40 to 44 for that year. It's quite similar for the 55 to 59 age bracket as well. And yeah, just a nice slide just about my team. So as I've introduced myself, I'm the health check lead, and I have 3 practitioners in my team. So we have Amanda, Sophia and Susan, and they're out and about in different places each week, delivering the health checks. So yeah, great team. We just have a bit of feedback, or sort of testimonial, I guess, this was from our Wilden Colin tour. So Jane came on board and she said, "What an excellent idea. It was such a relaxed and comfortable setting, so much more pleasant than the often clinical atmosphere of a doctor's surgery. I found it far easier to get an appointment too, which made the whole experience more accessible and stress-free. I really believe that services like this should be offered to the community on a regular basis. Making healthcare more approachable in this way means that more people are likely to attend, and hopefully more illnesses can be detected and prevented early." So yeah, just a nice bit of feedback there from one of our Wilden tours. And yes, that's kind of a deep dive into the NHS Health Checks that we offer. Like I say, a big part of our model is delivering the health checks in workplaces and in the community. So we're always happy to come along to any appropriate groups or workplaces who are interested. So if you are interested or know anyone that is or will be, please do get in touch with me. My email address is there. Just pop me an email and then we can get something sorted.
Right, lovely. So yeah, thanks, Hattie. Really interesting. I always learn something new every time. So yeah, it's really easy to refer into the service. You can go onto our website and there's a get started button on the top right hand side there. And you click on that and it's a form, really basic form. It takes about 1 or 2 minutes to complete, basic contact details, and what it is that you're interested in getting help with. And you can fill that in as a professional referring for somebody else, or you can fill it in, anybody can refer themselves as well. So you can fill it in, just the clients can fill it in themselves. Or you can just phone us, that's our support team number there, or you can just email us, hello@oneUEsussex.org.uk. And also, if you do work in health settings, if you just do a search on your systems of health checks, healthy lifestyle, stop smoking, whatever it is, it should come up with One UE Sussex, and you can refer quite easily from your clinical systems, and it gets sent directly to our secure NHS email. So yeah, so that's us done. Is any questions that have occurred to you? Shelley?
Yeah, hi, because I've sort of come in with a probation head on, because with our client groups, well, I'm thinking probably staff could do with this too, but I was thinking more predominantly with our client group. We obviously work with people that are either released from prisons on licence or people just sentenced to community sentences, and often we've got really high health inequalities across our cohort of clients we work with. And what we do find is often trying to make referrals onto different services isn't the most reliable, because our clients aren't always the most reliable or organised, let's say, to get themselves to places. So what I'm trying to do longer term is do health hubs within our probation offices. Is my sort of longer term plan. I'm trying to pilot one in Brighton for October, but we've got a Hastings and an Eastbourne office. And I was thinking, is that something that, from both of your perspectives, I was thinking actually that yes, that the health checks would be a fantastic idea, but also from your One U services, if I can start looking into that, would that be something your teams could come out to be in situ? Because we kind of have this idea of shutting our office down, having one of the bigger rooms there with a number of different providers there, and actually while the clients are in situ, sort of getting them to come around so they can at least see what's out there, maybe encourage people into checks, or at least get that idea going, because we do the making every conversation count. But I thought actually sometimes we just need the providers in-house to kind of get there. So is that something I can email you separately both about to think longer term about doing that? Because I'd like to sort of run a pilot in each office, and if that's successful, kind of run quarterly sessions is what I was thinking in a sense. Yeah, but that's where I'm coming from, really.
Yeah, do you want to go first, Hattie?
Yeah, no, I was going to say, yeah, absolutely, yeah, that's something. Well, I think you agree, Lisa. That's probably something that we can, yeah, join
Yeah.
up on. So yeah, do give us an email. Pop us both in the same email if you want, and we can get something
Yeah, that would
arranged.
be
Yeah,
great. Yeah, I'm looking later in
Yeah.
the appeal because we've got a lot of internal sentencing changes coming from the government in September. So everybody's in a bit in chaos at the minute. But once that's settled,
yeah,
I was
that's
thinking
fine. Yeah.
later in the year. I mean, I think it's 90% men our cohort in our cases
Okay,
coming
so
through. So actually,
yeah,
it's a really male heavy population. Thank you.
Yeah, definitely. And from just a more general engagement point of view, yeah, we'd be really keen to come in, and we can run sort of regular info pop-ups, or just have a presence where we can talk to people, answer any questions, and refer them into the service. We do something similar for Change Grow Live. Change Live
Yeah,
Grow.
we
CJ.
yeah, Change Go Live. We work with
Yeah,
them. Yeah,
yeah,
we work with them a
yeah,
lot. So yes, I thought you might be linked in with them. Yeah, we want to do similar really to kind of get you
yeah.
guys there. It might just be helpful actually if you're happy to come into team meetings just to generally talk to staff as well, because they often have meetings in those offices. So yeah, I'll drop you both a line. Thank you.
Yeah, brilliant. Thank you, Shelley. Any other questions?
If you want to find a location for a One U clinic, how do I go about that? Is it on the website?
Yeah, so if you go onto the website page, go onto the website, and then there's a programs tab, and if you whichever program that you're interested in, and then you have to scroll down to the bottom of that page, and there is an interactive map there, which it's got the maps, the little icons, location icons of where we are. Yeah, but obviously with health checks, I don't want to speak for you, Hattie, but with health checks, obviously if you're interested in us coming in for your staff team, then that's something that Hattie's team offer. They'll come and do workplace visits. If you have enough people that want to access us, we can run especially for you.
Yeah, definitely.
Yeah. I do assessments for carers all over East Sussex. So, and we always come across, well, might be someone that smokes or alcohol dependency, for instance. And so at the minute, we had someone come into our meeting and do a piece on smoking cessation from One U called Eleanor Wood. And so we've been putting emails through to her if someone needs smoking cessation support. So yeah, it's just useful to know where the nearest place would be, just in case when things come up, as and when.
Yeah, so definitely that interactive map on the smoking cessation program page of the website would be the easiest point for you to find that.
Yeah.
But yeah, and this is for your service as well, and also perhaps for Shelley's, but also if you were interested in the making every contact count training for your staff teams as well, if they're regularly having those conversations around health and wellbeing with people, they're coming up, as a matter of course in their roles, then that's something we could provide to you as well free of charge.
I think I've got the training tomorrow morning at 10 o'clock.
Oh, have you? Oh, then you can decide if you think it fits for your team.
Yeah.
Excellent.
Thanks.
Anything else at all? Any other questions? No. So, thumbs up or thumbs down? Do you now feel that you know what our health check service offers? Have we covered all questions? Yeah, brilliant. Thank you. And do you feel that you would know how to refer into the service relatively easily? Yeah, you know where to find it. Brilliant. Our work here is done. So this is Hattie and my contact details, and as I said, I will share the slides with you as well. I'll send them out by email. If you didn't sign on and the link to join this came from elsewhere, then maybe jot your email address in the chat box and I'll make sure that I send it to you as well. And we also have 2 dedicated primary care liaison officers as well in my team, because about 50% of our referrals do come from primary care, actually, for the service generally. So you've got Lorraine there and Koa, so I'll pop their details down as well. And then finally, a feedback form. So if you get a moment, and I'll send the link out by the email as well, follow-up email. But if you have a spare minute to fill in this, then we're very interested to hear back from you on what you thought of the session and how we can improve it for when we run it again. And that's it. Thank you very much for joining us.
Thank you, everyone. Thanks for coming.
Thanks a lot.
Thank you.
That was really helpful. Yeah, cheers.
Brilliant.
bye.
Thank you.